Hey everyone, welcome to Baltimore County Fire Department EMS Academy. For those who I haven't met, my name is Sean Barinholtz. I am an anesthesia and ICU physician at Hopkins. I'm an active member of Pikesville Volunteer Fire Company, and I am honored of serving as one of the associate medical directors for Baltimore County Fire Department. On behalf of the medical director's office, the EMS office, Chief Nats, EMS Academy staff, Captain Lenny Stewart, thanks for what you guys do to help our community, and thank you for your dedication to lifelong learning. A big shout out to Ashley Brooks, a young member of Pikesville, who's helping us with our video platform and our chat. Ashley will be later in this training posting a link. Click on that link and get your MIM CEUs. If you have any questions or concerns about past MIM CEUs or can't fill out the form, please stay on with us after the training. And Ashley and I would be happy to help you and answer any questions to make sure that you get your MIM CEUs. So super excited to have with us tonight Captain Michael Hoffman and Heather Sheridan. Captain Hoffman has been with Baltimore County Fire Department since 2007. He was promoted to EMS Captain in March of 2022, assigned to EMS1-A. His past assignments at EMS4, EMS2, Medicaid, and Medic 4. Born and raised in Baltimore County, where he resides currently with his wife and 6-year-old son. Heather serves as the Chief of Homeless Services for Baltimore County's Department of Housing and Community Development. She brings 15 years of experience providing leadership and direct service to those experiencing homelessness in New York City and across Maryland. In New York City, she managed a 170-bed emergency shelter and safe haven for men, as well as 415 units of supportive housing for the homeless in Manhattan. While with the state of Maryland, she is responsible for overseeing state funding for homeless services and policy innovation statewide, and she was awarded a citation from Governor Hogan for her leadership of Maryland's Interagency Council on Homelessness. Throughout the COVID pandemic, she provided executive leadership for a team of 1,200 in the healthcare management field. Heather holds a master's degree in urban policy analysis and management with a focus in community development, finance, and homelessness from the New School in New York City. Both of you, thank you so much for being here tonight, and thank you for what you're doing for Baltimore County. Captain Hoffman.
Thank you very much, Sean. Just appreciate the opportunity to get this information across, and thank you, Heather. As you heard, she brings a very just amazing resume of experience and knowledge. So I really appreciate all of her help with our group and what we've been able to accomplish so far. So we'll just get right into it. I want this to be as informal and interactive as possible. Dr. Barinholtz will be monitoring the chat window. So as we go through this training, just encourage you to provide any questions, feedback, suggestions, personal experience that you've had. We're looking for all that information. We find it helpful to just make this whole process better. So some of the things that we're going to discuss tonight, I want to just provide all of our members on this meeting what Baltimore County services and resources look like for the homeless population that we serve. I want to provide all of you with a guide on how we can connect these individuals to resources when it's necessary or they're requesting that. I'm going to provide a little overview of the police department's mobile crisis team, kind of what they can help us in the way of dealing with homeless individuals and what their limitations are and their abilities. And then through this process, one of my goals was to provide guidance and in a way of a flow chart for us to use. We all love algorithms and flow charts and EMS. So my goal was to create one that, okay, we're presented with a situation. Maybe we transport this person, maybe we're not. Either way, a guide for us to know how can we really get to some long-term solutions for these folks and not just the quick, just transport is the only solution. That's kind of what we've had thus far. So those are the objectives. Hopefully you all can see my screen that I'm sharing. The first thing we'll do is go right to a case study. And this is kind of, this was a call that I had that made me start this whole initiative because it was a complex situation that the police department and EMS were faced with. nobody really know which direction to take it in. And, you know, there was a successful outcome after probably an hour or two. We did come to a good solution for it, but I wanted there to be a process to make it a little smoother, more efficient, and give us that guide. So the case study was that, in this case, I was the EMS officer that was requested by ambulance for a non-emergency injured subject. It was at a local gas station here in Towson. Of course, it was about 8 o'clock on a Friday night. We all know that a lot of resources are closed, or screening processes are closed at that time of day. So after I arrived, I meet the paramedic. He fills me in on the details. So there's not actually any injury. There's no real need for EMS. I'm not sure how the call type became that, but instead what had happened was a Good Samaritan called 911 after she showed some concern for a young mother and her 3 children. So the young mother was in her 20s. She had 3 kids as young as 7 months in a car seat with various belongings laid out on the side of the curb. I was informed that they recently became homeless. Staying with family or friends was not an option, and the medic and both the police department were looking for some direction because nobody really knew what to do. Fortunately, it was, I think, at the end of August, so the weather was still nice. It wasn't raining outside, so we had some time, but we all knew we were never going to leave that scene, even though EMS wasn't required, leaving them on the street, especially with the young kids. So what do? So over the next hour to 2 hours, we were all Googling on our smartphones the numbers for homeless shelters, any resource that we could get for this family. And long story short, we were able to create a solution. And I'll tell you about what that was later on in the training, but I just wanted to leave you with this case study. Start to think about, if you were the EMS provider on that call, what direction would you have went in? And I've asked that to a lot of people that I've delivered this to, and they say, oh, well, I'm going to call you. Well, that's all fine and good, but I need direction too. And so that's kind of how we landed here. So a couple of stats, and Heather will be jumping in as she sees fit, because this is her bread and butter, this is her wheelhouse. But last year, this is statewide data right now we're going over, there were over 5,000 people experiencing homelessness. 891 of those were unsheltered, so about 17%, and then the remaining were in some type of shelter or transitional housing.
And Captain, I'll jump in really quick. So good evening, everybody. Pleasure to be with you. Thank you for all that you do. In Baltimore County, we have about 600 shelter beds, and those are filled generally about 95% of the time each evening. We have about 50 overnight freezing weather beds, and those are generally utilized at about 75%. And then our unsheltered count, so folks who are without shelter living in a place not meant for human habitation, can range anywhere between 150 to 200, upwards to 250 across encampments across the county.
Thank you. We see the breakdown by gender, and it is more heavily weighted in the corner of males, with about 40% female. By age, most of these folks are over the age of 24. I'm not sure, Heather, maybe you could provide this, the kind of like the top end for an age group for adults. I would assume that your older adults are probably a little bit more high risk and eligible for services.
Yeah, the majority of our population in Baltimore County is between the ages of 25 and 55. We do have about 15 to 20% varying on during time of the year that are above the age of 55, and about 10% of those above the age of 62. Those experiencing homelessness are aging in place nationwide. It's not just Baltimore County.
Okay. Fortunately, the numbers below the age of 18 are relatively low, which is nice to see. And obviously those would fall into that extremes of age group where hopefully those people are being identified very quickly and eligible for services. So in Baltimore County, this was last year's data. About 458 people were homeless, and 140 of those were unsheltered, so about 30%. This year, and this I think was just through maybe the month of March, I haven't updated the data, but that number is now down to 21%. Do you have any updates on the current data? I think you're muted.
Heather, are you on mute?
I'm saying some great stuff. That is our point in time count. That kind of a snapshot across our whole system, shelters, rental assistance, eviction prevention. Our system serves anywhere between 3,000 to 4,000 people annually across all services that are available to people experiencing homelessness.
Can you touch really quick on how that point in time count goes, and how probably, I'm assuming how difficult that's probably is to do?
Sure. Yeah. So real quick, we have a system that we put data into, just like all of you do, to track the work that happens throughout the year. So we have annual counts, of course, but each year we are required, each jurisdiction receiving federal and state funds for homeless services is required to do what's called a point in time count. It is a snapshot. It is done within the last 2 weeks of January, and it is done nationwide. It's over a 24-hour period. We count everyone that's in shelter, that's in a bed that we have, but then the unsheltered count is the part that maybe some of you have volunteered for. We engage with police, hospital partners, nonprofits, organizations, volunteers to go out, and we basically try to cover and canvass as much of the county as we can over that 24-hour period and count people who are experiencing unsheltered homelessness. We survey them with a basic set of questions to get a sense of who they are and what led to the homelessness and what it is, what benefits and income that they may or may not have. And then that census is turned into HUD every year, and that goes into the annual homelessness assessment report, the AHAR, that allows HUD and our federal partners to say nationwide homelessness is increasing or decreasing. You may have heard that it's decreasing. Unfortunately, they're basing that off of numbers that are lower during COVID. The point in time counts were lower during 2020, 2021, and even 2022. Some jurisdictions did not even do a point in time count, but Baltimore County is great, so we did it every year. Those numbers were lower because our volunteer numbers were a bit lower.
Did you have expanded availability for shelter during COVID because of that?
So during COVID, our homelessness response during COVID and what we did in shelters was similar to what was happening in hospitals. That was not normal across the state. So if any of you volunteer in other parts of the state, you might not have seen quite what we did at Baltimore County. We had quarantine area and people who were in hotels during COVID, who were COVID positive and symptomatic or asymptomatic, and not in shelters. So our general shelter census and the number of beds that we had was down to 50% from the majority of COVID, went slightly up to 75%. And at the start of, towards the middle to end of 2022, we were inching back up to 100% available capacity. Now, if we have COVID positive cases, there are still a few. We do quarantine folks, but we're starting to see the shelter population go back to what it was prior to COVID.
Okay. So anybody that does EMS, we all know that homelessness has a direct correlation with poor health. These folks, many of them are mentally ill. Many of them have substance abuse issues, and they just don't have the access to healthcare or primary care, whether medications or management of those things or any chronic conditions. So that's a pretty no-brainer. So in the state of Maryland, about 23% of the homeless that were counted have severe mental illness, 19% with substance abuse, and 2% with HIV or AIDS. Some of the other problems that we're seeing, about 6% are victims of domestic violence, 6% are veterans, 4% unaccompanied youth, and 1% are parenting youth. So obviously, homelessness shares a relationship with EMS. Whether we like it or not, we will continue to go and respond to homeless individuals. Just the way it goes. That often these folks are in the public. The public is concerned. We get many calls for unconscious subjects. We'll arrive and find out, well, they're not really unconscious. They were just sleeping. This is their campsite. This is where they're staying. And that right there is an opportunity to talk with them and try to connect them to a resource. Obviously, a lot of, like we just said, have a lot of health problems, substance abuse issues, and they'll present to EMS for those problems as well. We transport a good number of our homeless population, and that's perfectly fine, and a lot of times it's warranted, but sometimes it's not. And if the person that, whatever their problem is that evening or that day, it's not really a warranted trip to the emergency room. We already know our emergency rooms are overburdened. They're going to be discharged probably before they can even speak to social work or get connections. The hospital's got to make beds available. And we already know our EMS resources are taxed. Almost every day we have times of the day where we get taxed. So if they need the hospital, that's great. We're going to take them to the hospital. Sometimes they don't, or they'll present with a complaint. And maybe if you really get to talking to the person, that's not really why they called. So maybe, through this system, we can identify really what their needs are. So what are our goals when we encounter the homeless? We should, number one, treat them with respect. A lot of stereotyping happens. I get it. We're all human beings, but we need to be an example for our younger employees and mentor them and just treat them with respect. We don't know their story, why they became homeless, and we shouldn't assume that. Of course, our safety is also going to be paramount. So if you feel like in order to handle that call that you need more resources sent to you, then obviously call for those resources. That could be an engine crew, that could be the police, that could be mobile crisis, you name it. We're going to provide any needed medical care that they need and transport according to our protocol. And then identify those that need resources and try to make a connection. And like I said, that connection can happen whether we transport them or not. If they get discharged before that the hospital can really take care of that, then at least we start the process for them. And it could be as simple as sharing a phone number. So something. Some of the other goals, and this is something that we're doing.
Captain Hoffman, somebody put in the chat, there was a veteran stat. I'm not sure exactly if you remember what that may be.
I think it was 6%, which I'm sure they're probably looking at that and thinking it sounds pretty low, and I felt the same. Heather, do you have any insight on that?
Yeah, so we've done tremendous work over the last year, in particular, focusing on our veterans who are experiencing homelessness. There's a lot of federal and state resources for them. So that overall percentage of veterans served across our, all services, it sounds accurate. But I will say over the between January 2022 and the end of going up to May of this year, we served across our continuum about 150 total veterans, and of those 40 were housed and 20 more are waiting for VASH vouchers. So we have a by name list of veterans that we meaning my team focuses on with our VA partners and service providers and outreach providers, and go by name every veteran. If you are homeless and are a veteran, regardless of status in Baltimore County, we're meeting and talking about your homelessness situation and your housing needs on a bi-weekly basis to get folks housed. There are resources for vets, but if you are a vet, thank you for your service. Dealing with the VA is a little complicated. So veterans is a priority for us for sure.
Do you think that answered the question, Doctor?
I think so. Yep.
Okay.
He says yes. Thank you.
Okay. So some of the other goals, and this is kind of what we're doing with our work group, and I'm going to talk about our work group and what that has entailed thus far, but we are, as a fire department, collecting the data and the outcomes on these encounters. So if any of you have noticed, a couple of months ago, we added a supplemental question to our EMS reports that asks if your person was homeless at the time of the encounter. So what that does for me is generate a report that I get weekly, which we can then start to analyze that data, and it's broken down into very many more categories, but things like, did we determine what the cause of their homelessness was for? Were they transported to the hospital? What zip code are they in? So we can look at that data and really just get a whole lot of useful information out of it. So please answer that question appropriately. Please don't choose the NA. It doesn't help us at all. In your narratives in your EMS report, what I'm really asking you all to do is, whether you transport them or not, if you were able to provide some kind of connection, just give me a sentence on what that was. It could have been you provided them with a phone number for prologue. It could be no EMS was needed, and the decision was made between you and maybe the supervisor that, you know what, this situation is kind of high risk and we're going to transport them to a shelter that we've identified has a bed for them. So whatever you actually do, I just need a little tidbit of that information so that when we scrub this data, we can enter it and we know what we did and what we need to be doing better on.
And if I may,
Um,
Captain, quickly with the data piece. So the days of homelessness, if any of you have ever seen the movie In the Pursuit of Happiness with Will Smith, where he spends most of that movie running to get a shelter bed every night. Those are the old days of homelessness. Luckily, things have changed a lot in the shelters. People can stay a little longer, catch their breath, do what they need to do. And if they're not doing what they need to do, they need to move on. But another piece that's changed with homeless services across the nation is data-driven decision-making and policy and prioritization and emphasis in figuring out what are we funding, why are we funding it, and the days of funding things repeatedly are no longer. So the work that I'm doing with the captain and the team, I'm very excited about, because that data, while it's hard for you all because of everything that you do, it is getting used. And we're using it to figure out where to send homeless outreach teams, where to focus to give you additional support. So thank you for that data. And we're analyzing it to figure out where we need to be and how we need to support you.
So thus far, we have found that probably the easiest way to collect that data is through our EMS reports. Now, I understand a lot of these, like the example I shared earlier, we get it as a medical box, we send an engine supervisor or medic out. Maybe the engine gets there first and determines there's no one that's unconscious here, they were just sleeping. So the medic unit never arrives and an EMS report is never generated. So what I'm asking our suppression folks is, if you have that happen, please give me something in your NFIRS narrative. The other thing is, it's a lot harder for us to track homelessness that are encountered by our suppression crew. So we do have a data analyst that's working with us, Irene, many of you know her. She's able to pull CAD data to see if homelessness was basically included in the comments of the call. That's how she identifies them. But that's not always accurate. So really what I would ask you to do, I think the best way until we figure out a better method, is if you're on an engine, you go out, you clear EMS because it's an EMS needed call. You do put something in your NFIRS narrative, the same kind of thing, like what you did, if you connected them to a service or whatever. And then if you can just shoot me an email, and I'm going to give you my email at the end of the presentation, but those are ones that I can go back in and enter myself, or our team can. So bottom line, we need something that tells us what happened on the scene so we can clean up the processes, identify problems, and do a better job. So you'll see that last line in the slide. It says, data collection and resource connection can help to prevent and reduce chronic unnecessary EMS response and encounters. So the goals here are twofold. Number one, we want to help these individuals if we can. Number two, we want to make our system as efficient as possible. I love efficiency. I try to get involved in sometimes with our response profiles, and if we're really stressed with resources, I want to send units where they can be of most benefit. So just like these, the analogy I like to use is, I like to clean the house 5 minutes every day versus 2 or 3 hours once a week. So if we can put a little bit of work in each day on these, get that early data in, provide those connections, these folks may start to get what they actually need, have some of those gaps of their medical care closed, and then maybe they are not homeless anymore, or at the very least, they don't decide that they need to use the EMS or the hospital for problems that could be handled by primary care or other means. So just a little bit of effort each time you encounter someone may actually benefit everyone in the long run. So often the response to a homeless person will include multiple departments, so police, fire, sometimes a joint response. And up in Towson, I have a lot of very young police officers. Like on this call, they were very helpful, but nobody really had any experience with how to deal with that situation. So just understand, we all need to be patient. We might have somebody on the team that has been down this road and knows exactly what to do, or maybe not. You should request resources as you need to deal with the situation. So calling for an EMS supervisor to help guide you in what to do could help. Calling for the police department, you may need to do that. The mobile crisis team is such an asset in a lot of these calls. I would highly recommend that if you have someone that you really feel like is high risk and you're having some trouble connecting them to the resources they need, mobile crisis is probably going to be your friend on these. Okay. So the mobile crisis team specifically. So for any of you that don't know, it's a police officer and a licensed mental health clinician. That mental health clinician is not a county employee. They're contracted by Baltimore County and they're part of the Sante group. So some of the resources that are available, depending on the reason for the homelessness, have to be approved by that mental health clinician. An assessment has to be done. That cannot be delegated to us or the police department. Also, patrol units, a lot of times, and we've all experienced this, their criteria for doing like an emergency petition are very straightforward, very black and white. It's either they're homicidal or suicidal, and they have to show some kind of evidence of that. Otherwise, the patrol kind of has their hands are kind of tied. Mobile crisis can deal with this kind of situation a lot better than patrol. And so if you think that you need mobile crisis, request them early. Generally, it does have to come through the police department. But if we say to dispatch, hey, we're probably going to need mobile crisis, can you let the police know? Hopefully they'll get them started before coming out themselves to determine that. So as far as mobile crisis, anybody, any member of the public can call the mobile crisis team, and that's the 24-hour hotline right there on the screen. If we want them actually real-time responding to our incident, that generally has to come from patrol on the scene. So you need to get police on the scene with you. If you have any issues with patrol just being unwilling to have mobile crisis come out, please pass that along to your EMS officer. Get the EMS officer involved. You know, and usually we can fix that problem right there. Like I said, the resource that they bring to the scene is so much more than any of us can do on our own. So we really have had very little trouble with that, but we have had occasional issues. So if you have that, just get some more people involved, and then we can, you know, I have met with precinct leadership in the past just to work together and work through problems that we've had, and it's been very good process. So if they're unwilling to have mobile crisis come out, the other thing is mobile crisis may not be available to come out. Okay, so at the very least, if you think that mobile crisis is needed and that individual can benefit from their services, pass that phone number along to them. Okay, so that's 24 hours. So for their team, they have 4 cars assigned to it, and 3 to 4 of those cars are on the road depending on the time of day. The only time that they do not have coverage is from 1 in the morning to 6 in the morning. Their coverage outside of those hours kind of overlaps. But just so you know, that's about how many cars that they are working with. And I think, as we all know, mental health is being more readily identified nowadays, which is a great thing. And so I foresee this team is going to continue to grow. And their personnel are just wonderful to work with. Like I said, they've been really helpful for us on many calls. We talked a little bit about emergency petitions. And so just wanted to kind of go over with everybody who by law is allowed to do one of those. Okay, so physicians, psychologists, you'll notice the psychiatric nurse practitioner. So it cannot just be any nurse practitioner, it needs to be a psychiatric nurse practitioner. You'll go down to see a lot of different social workers and therapists, of course, peace officers, so in our case, the police. And then if none of those parties can or are willing to do one, then of course the family can go and petition the court and provide documentation. It is not necessarily our job to remember all of these different titles. Those that are lawfully able to do an EP, that's obviously their scope of practice. But, you know, we don't need to worry about if they're really able to do one or not. But just kind of so you know, it's this kind of information is useful in helping to educate family and things like that. So, you know, if you're in a situation where you really feel like this person's in an unsafe situation, you really think an EP is necessary to get them to the hospital, you know, ask the police if they'll do one, get an EMS supervisor involved, and then mobile crisis may come through for you when the police cannot. I'll just share a quick call that I had just a couple of months ago. So we had an older gentleman who was living by himself in deplorable conditions. He was awake, lucid, could tell us everything we asked him. But his living conditions were really bad. He had a lot of medical problems. He was clearly not able to care for himself in the way that is expected. We had big concerns for him. He was not initially very cooperative with wanting to go to the hospital, but we all knew, like, we're not leaving the scene until he goes, because we're not going to leave him in that state. So the mobile crisis team was called for by patrol. We didn't have to ask. They were not, the patrol units were not going to be able to EP him because he wasn't homicidal or suicidal. But mobile crisis took one look at the guy at his house, and we're like, no problem. We're going to EP him. We're actually also going to do an APS referral. So these team of folks can really be useful, where our hands are just kind of tied. And obviously, we did an eye care referral on him as well. And so all of those things were very necessary, and like I said, they were very useful to us. So that mobile crisis team mental health clinician can certainly provide an EP if it's needed. Consider requesting them. Obviously, their team is not limited to the homeless, but we may encounter the same type of situations with the homeless, and then there are some of those cases where a resource is kind of dependent on their assessment. You may need an eye care referral or an APS referral with some of these situations. So generally speaking, you're not going to use the eye care system for most of our homeless encounters unless they are very problematic, high risk, multiple encounters. Then at that point, we'll probably hit it from about every angle that we can. So an eye care referral at that point may be warranted. Fortunately, Lieutenant Wenzel, who's in charge of our eye care team, is part of this homeless work group as well. So we're going to know one way or another. But you know, putting somebody like that through multiple channels is going to provide the best outcome, hopefully. So in Baltimore County, homeless management falls under the Department of Housing and Community Development, which Ms. Sheridan works for, and then the Department of Social Services. And so these two departments share a responsibility to provide services to those that are homeless or those who are at risk for becoming homeless. They handle homelessness with all of these services that you see listed: the street outreach, shelter, eviction prevention, rehousing, permanent housing, supportive services. As far as the shelters go, here are some of the different types. So in EMS, we are probably most familiar with the freezing weather shelters, which at this point of the year are pretty much done for because it's warmer, thank God. Mm-hmm. And then the emergency shelters, which we're all pretty familiar with those as well.
And just real quick, so the distinction between freezing weather shelter and year-round shelter in Baltimore County, the barriers or the requirements to get into year-round shelter are slightly higher than freezing weather shelter. So freezing weather shelter, if you had anybody that you dropped off at freezing weather shelter, generally you come in, you get a cot and a meal, very little questions asked. It's not quite as easy as shelter year round. We're working on that. Shelter should be that easy. And we're going to talk a little bit about the coordinated entry hotline, which is the phone number that is manned during the general working hours, 8:30 to 4:30, to get shelter referrals. We can talk about that soon.
Sure. So as far as the freezing weather shelters go, so they are activated based on freezing temperatures. The Department of Social Services will send out an email each day that is open. For us in the fire department, we all know that ADO sends out the email for when it's going to be open, what time frame. And that's sent out to career, and I'm pretty sure volunteers as well. But if you're not sure if it's activated, simply go in the ADO talk group and ask them, and they'll tell you. And they'll also tell you where the locations are, because those tend to vary a little bit. So typically, entry for the freezing weather shelter starts at 6 p.m. And those folks are asked to arrive between 6 and 10, but I confirmed with Heather that if you show up at 11 or 12 and it's cold outside, you're not going to be turned away, okay? And you also don't need to go through that same coordinated entry process that we're going to talk about in just a minute. So if we end up, for whatever reason, handling a transport there, or the person is interested in going there and can accommodate their own needs to get there, they are welcome to show up as long as it's open. So the locations, like I said, refer to the email or refer to ADO. Typically, the east side is going to be the Eastern Family Resource Center They're located on Franklin Square Drive, just a short walk from the hospital. And then typically there's one on the west side. Here lately, before it got warmer, it was the Woodlawn Library in the basement there.
I'll say real quick, it's hard for us to find locations for freezing weather shelter. So these are extra beds that we stand up for the freezing weather accommodation. And we typically have to utilize county-owned buildings already because it's been really tough to get even churches and different organizations to open up space. As you can imagine, there's a lot of concerns around logistics. So we're working on that. But those are generally the two locations and why.
As far as the emergency shelters go, so these are the ones that most of us are familiar with. Typically, you have up to a 90-day stay, so they have to basically be there has to be a bed available, and they're assigned that bed. And so you can see just in that next sentence all of the resources that come with a shelter. So if we can simply get someone connected, all of those other things come along with it, which could very well get them back on their feet and get them out of this homeless population. So, like I said that earlier, that little bit of work, just the connection piece could open their world up and hopefully get them back on their feet. So the locations currently, east side, we already talked about. So that's the same spot as the freezing weather shelter, which is the east side family shelter and men's shelter on Franklin Square Drive. And then on the west side, you have 4 options. So Night of Peace in Milford Mill, the Hanover Shelter in Reisterstown, the West Side Shelter in Catonsville, and then the Interim House in Pikesville.
I'll say really quick, Captain, if I may, the year-round shelters can be a tough sell. You may have, as you're having a conversation with someone, and we can talk about this too in the Q&A, who are refusing shelter, who say, no, I've already been there, it's terrible, I got attacked or something like that. I'll give you some pointers on how to kind of open up that conversation a little bit. Sometimes people have had experiences in shelters in other jurisdictions or in Baltimore City, good, bad, or indifferent. We weren't there to say, but the congregate shelter is tough. I will say that. So if you are with a family, if you're a single, regardless, it is most of our beds, the 600 shelter beds that we have across the county, most of them are in a congregate setting. Large rooms, bunk beds, it's not easy. And so why we're not at 100% capacity in shelter, or why some people refuse shelter, we ask questions when they call coordinated entry about, can you get up in a bunk bed? How much do you weigh? Are you mobile? Things like that. So I don't know if any of you have slept in a bunk bed lately. It's a little challenging. So just some insights. You may have already seen that when you've dropped people off at shelter, but there are some reasons why people refuse, and we can talk through that if you have some questions about how to dispel some of the myths.
Great. So like Heather alluded to, so if it's an emergency shelter and it's not on the freezing weather activation, then you do have to use this coordinated entry process. So at the end of this training, I'm going to show you all the flow chart that we created, and this whole process is going to be included on that. But they call that phone number, press option 1. They'll talk to somebody in person. The hours currently are 8:30 to 4:30 during the week, which obviously we all know can prevent some issues for us. In my case, it was 8 o'clock p.m. On a Friday. There is an after hours process. My experience with that is they may come through for you in like this high risk circumstances. If someone is otherwise like safe, the weather is not bad. It just kind of depends. And Heather, maybe you can talk a little bit more about that. But that after hours process, that phone number is an umbrella phone number for many different things. So if you feel like you have a situation where it's after hours and you're really concerned about leaving this person, then I would ask that you call that. And there's other options too. And once we determine why they're homeless, that could kind of point us in maybe another direction. But go ahead, Heather.
Yeah, so it is. So in addition to that, we do have Prologue that does homeless outreach, provides homeless outreach. Many of you have probably already interacted with them. The phone number will be on your flow chart. They are one of 2 paid homeless outreach teams. Community Assistance Network is the other one. Prologue does work past 4:30. If you have someone, especially if it's somebody who's a repeat, this person is you see them on a weekly basis. And let's say you've talked to them about shelter, as the outreach team has as well. And let's say out of the blue, they say, fine, I'll go. And they're willing to go. You can call Prologue. We do have a process called Streamline Beds that our outreach teams have access to. They are an access point to our system. And because of that tight restricted time frame of 8:30 to 4:30, we're asking our outreach teams, and they have the ability. It's not perfect, and that's where that feedback loop comes in, as the captain mentioned. But you can call Prologue, and they can help get somebody into shelter that night, especially if it's someone that has really been refusing and they finally say yes. We do have some options to make it a little easier. But again, not a perfect process. We're working on it.
So if the individual has their own phone, it's best if they make the phone call, because you may not get that call back immediately. So advocate for that.
Yeah.
So as far as the shelters go, one of the questions I had was, and there's a lot of misnomers, you just kind of hear word of mouth, is there excluding criteria? I've always wondered, if somebody is under the influence of alcohol, like, oh, no, there's no way they can go. Well, it's not necessarily true. So if somebody has consumed alcohol and they're not inebriated to the point where they're slurring and they can't stand up, because in those cases, we probably should be transporting those to the hospital. If they're not in that state, yes, they can still go to the shelter, as long as they're not belligerent. And like I said, they're not completely inebriated. Obviously, alcohol is not going to be permitted inside. And so please, the caveat there is don't allow them to just kind of chug the rest of their remaining alcohol. I've seen people pour out their remaining alcohol. I wouldn't recommend you do that, because I don't want to put anybody in an unsafe situation. And who knows how long it took them to get the money to buy that. But they're not going to be able to bring it in with them. Weapons. So if somebody has like a pocket knife or something like that, they can certainly check that at the door. But any kind of like lethal weapon, like a gun or anything significant, obviously that's not going to be permitted. I have not yet encountered a homeless person with a gun, but you never know.
Yeah, let's hope that doesn't happen. And real quick, freezing weather shelter and year-round shelters do have lockers at the front door. It might sound strange, but so that it is not a barrier to entry. It's a place for people to check things, and we've seen all kinds of things. As you can imagine, if you're out in the woods, you might have a large knife, things like that. No guns can be checked, but items for protection can be checked for people to come in and leave in the morning with it.
Heather touched on Prologue, so they're going to pretty much be like your second string, especially outside the normal hours. So if you have somebody, like, well, I'm not interested in the county shelter, but I'm interested in something, then Prologue will kind of be your next string. So give them a call, and they have a lot of the same resource availability as a county shelter would, and all those connections. So same kind of thing. They provide shelter. They provide services for domestic violence, substance abuse. They can help out with veterans. Different medical problems, psychiatric disability. They do have an outreach site in Towson that's currently under construction. If any of you are familiar with it, it was like a blue single-family house on Baltimore Avenue. Heather can give an update on that, but they're building a new facility, and I think we talked about this before, but once it's back up and running, they'll have some hours during the week where people can come by.
Yeah, so it's really exciting. So the old house that they had was it was an old house. They had one shower, one set of washer and dryer, and people could come in and get a meal. The new facility is really exciting. It's going to be beautiful. Hopefully, going to be finished by the fall sometime. It's going to have a larger laundry room, many more showers, larger space for people to come in and utilize. And yes, it was just opened 1 or 2 days a week at the smaller location, but they're hoping, and we have been able to fund to have staff there at least 4 days a week, if not 5. And that really has been a saving grace for folks who are street homeless to come in and just sit down and take a breath.
Good. So specific to domestic violence, so if you learn through your encounter that the person has become homeless because of domestic violence, get the police involved, obviously. Okay. You also want to consider asking that they bring the mobile crisis team. So this person, depending on the nature of the violence or how recent, we may need to transport them. And we know that we have some safe hospitals throughout the county and city. So just a couple of notes. if the violent acts occurred in the county, then GVMC is our safe hospital, and that's for adults and pediatrics. Obviously, if they're badly beaten and need a trauma center, then you're going to go to a trauma center. If you encounter them in the county, but you think that the violence occurred in Baltimore City, it's going to make things a whole lot easier if you take them to a city hospital, because the Baltimore City Police Department is going to be involved. And it's just easier if they are operating in their own jurisdiction. So if it's an adult or actually anybody 13 and up, Mercy Hospital is the safe hospital for that age group, and then 12 and under go down to university. And just make sure that through the county police that the city police are made aware of what's going on.
I will add quickly. So this is all about partnerships and kind of a warm handoff, right? So with DV and any kind of trafficking, stalking, obviously you showing up in a uniform can be a little intimidating for whatever reason. So the warm handoff and the good resource that we have are domestic violence coordinated entry, which is if anybody mentions anything, regardless of how recent it happened, if they are there without shelter because of that, or if it's related to any of that, the hotline that you call, and it's on your flow chart for the domestic violence hotline, is manned by 24/7 by volunteers who are extremely caring, patient, very aware of, trauma informed, and person centered. Specifically related to trafficking and any kind of stalking, Turnaround is a great resource as well. It also has a hotline and has volunteers to answer. So in case for some reason it's not clicking with you, you have someone to hand them off to. And then we also have the street card captain that we're going to be able to print as you requested, so we can talk about that too. So you leave numbers with folks so you don't have to write them on paper.
Great. So there's the 24/7 hotline right there. Like you said, it's going to be on the flow chart. The Family Crisis Center provides shelter, meals, essential services once again up to a 90-day stay. We talked about Turnaround, another organization that helps specifically with TV and trafficking and things like that. They may be able to get a temporary housing situation for you, hotels, that kind of thing. Get mobile crisis on the scene for these, because they need to do an assessment. Turnaround is probably going to talk to the victim and the mental health person. And so this is a specific cause of homelessness that is probably going to get the victim placement a little easier than someone that there's no real, it's more of a general cause, and they're not high risk. So this is one that we can probably help them with.
And I will say calls to these numbers, the DV coordinated entry and to Turnaround, while your protocol might be to involve crisis response, it's not required. The folks that answer those calls can ask what they need, ask the questions that they need, and figure out lethality and risk immediately, and determine based on those two factors if a hotel placement can be made that night. There is resources for that for folks who are fleeing and might be too scared to engage again with crisis response. So that's not required. Those phone numbers can be left. They can call from their cell phone and get what they need.
Great. So we touched on, we know that a lot of homeless individuals have substance abuse issues. So I think we're probably all familiar with the Narcan leave behind kits. And so we always have asked if you give one of those out, that you leave a phone number for that individual in your narrative in your EMS report. If it's an engine or supervisor and maybe an EMS report is not generated, maybe you just have somebody stop in the station and ask you for a Narcan kit, by all means give them one. We just need to have a way to track those. So you can share that phone number with the individual. You can write an email to that email address listed there to say, hey, look, on this date, we give this individual an Narcan kit. And that team will reach out to the person. They'll talk to a trained peer specialist, usually somebody who's been through that themselves and is very aware of what comes along with that. They'll get that support that they need, family support, refer to addiction treatment. And so the Eastern Family Resource Center on Franklin Square Drive has a free walk-up screening and referral clinic for substance abuse. So as far as veterans, so if you are questioning the person and they say, yes, I'm a veteran, Shepherd Pratt has a service for those folks that are homeless. It is not Heather can talk a little bit more about this, but it's not psychiatric in nature. So if you feel like somebody's getting scared off when you say Shepherd Pratt, it just happens to be based out of Shepherd Pratt. There's a specific phone number. So the person just has to have been a veteran for a day without a dishonorable discharge. And obviously that's not really for us to question. If they tell us they're a veteran, okay, we're gonna set them up then. Did you want to speak about this service?
Yeah. So vets, if they say I was a vet, again, it's not for you to figure it out. You can give them coordinated entry if they say they want shelter. And if domestic violence also applies to them, you can give them those numbers. The resources through Shepherd Pratt is called SSVF, Supportive Services for Veterans and Veteran Families. So if you are a veteran, regardless of discharge status, and if you have served, you know that there's multi-layers of that discharge status. You can therefore qualify for a full HUD VASH voucher, which is like a housing voucher, or you can qualify for short-term rental assistance. And those SSVF providers, one of which is Shepherd Pratt, is the one that can connect, and it's case management. They can help you find housing when you're a vet. So it's a really good resource. We have two that are serving Baltimore County, Shepherd Pratt and then Project Place. We didn't put Project Place on your flow chart because they're primarily focused on Baltimore City, but that's an entry point for a vet who's tired of dealing with the VA because it's too large and too much bureaucracy. So
if the Shepherd Pratt program, for whatever reason, cannot help, would they be able to connect them to the alternative?
absolutely. And if they are a veteran and they go to Shepherd Pratt, they go into our homeless management information system, and we will talk about that veteran and their needs in those biweekly meetings. And make sure that they're connected to SSVF provider. And if they are unsheltered and wanting to stay outside, making sure that they're connected with Prolog or CAN, the outreach team. Or if they're in shelter, if they decide to accept shelter, we make sure that those SSVF providers connect with the veteran while in shelter. As the VA also has outreach staff. It's a lot. You get a lot of support when you're a veteran. So, and we don't confirm status to make sure of that. You get the help, and then the status comes second. Baltimore Station. Sorry, there was something in the chat here. Baltimore Station is an option in Baltimore City. You're absolutely right. Primarily serving vets, as is MCVET in Baltimore City. MCVET has some higher requirements in terms of entry. There's a 30-day blackout period and some other things, but there are some more resources. And the VA also has a walk-in clinic, an SSVF provider in the city as well.
Heather, if an attendee wanted to know what services are available in Montgomery County, is there a general place where they could at least start to look?
I can look that up and get you some information. Montgomery County also has a coordinated entry hotline. Give me a few minutes and I'll drop some stuff in the chat.
Thank you.
And as far as if Montgomery County, like their fire department, is doing something similar as to what we've done, I really can't say for sure. Like I said, I had that call, I identified a need for us. And this is kind of like, we just wanted to provide all of our providers and clinicians with a guide on what do you do. So in this slide, more veterans. So this is just kind of some of the things that make them eligible. So that 1 day of active military service, discharge other than dishonorable or bad conduct, very low income, at risk of becoming homeless or currently homeless. So like we said, our job is not really to identify if they meet those things, just kind of for your knowledge base. But if they say that they're a veteran, then that's good enough for us to at least begin the process, and then someone through the process will vet all that. Here's another organization. I don't know a whole lot about them, but they're going to serve the population of Northwest Baltimore County and Baltimore City. So it is a Jewish-run organization. You do not have to be Jewish to be served by them. That just so happens to be their organization is Jewish-run. And they deal with a lot of the same things. So somebody that suffered abuse or trauma, they have counseling, crisis intervention. They can provide legal advocacy and shelter. That's another option, and their information is going to be located on the flow chart as well. So what have we done so far? So I had that call at the end of August, identified the need, started speaking with Lieutenant Wenzel at headquarters, who connected me to Heather. She was already working with the mobile crisis for other projects. So we formed this work group. So currently it's between myself and Lieutenant Wenzel. Heather Sheridan, the police department, specifically their community outreach and their mobile crisis team. And so we have met, gosh, I don't know, 6 or 8 times probably. We have shared ideas, kind of figured out where we wanted this project to go. I think all sides of the work group have found it very beneficial. We're excited to be able to share a lot of this data that we have with Heather and just find out how processes are working. So it's still very new. The information that we've started to analyze, we've only been doing that for about a week or 2 now. Just the other parts of getting this up and running were putting together this training, the flow chart, getting that distributed. So now we're starting to get the data. My hope is that as we educate all of you on how to deal with these situations, that we'll be starting to actually get good data in your narratives, determine connections and what was done and stuff like that. So for anybody that is not on this training, please spread the word. Okay. So up to this point, I can say that all of the EMS supervisors were outfitted with these flow charts. There's enough to go around for every EMS supervisor's vehicle and every transport unit in Baltimore County, volunteer and career. I left it on the EMS units for now. I've talked to several suppression crews and station officers who are very interested in helping. It's certainly easier for the data collection piece to be on EMS with the patient care reports, but we know that depending on where you work, you may have a very high population of homeless people in your district. So if anyone wants me to make them a flow chart for their engine or other piece, please just send me an email, say the word. I'm happy to share. The more the better. We talked about the supplemental question that's added. We hope to use that to kind of identify problem areas, like so heat maps. We want to identify those individuals that are repeats. So, like I said, twofold process, right? We help the individual and we help manage our resources in the most efficient way. We've all had individuals that we may go respond to 3 times in a single day. And of course, we get frustrated because we know that they don't need our services. But if you have somebody in your district that you're encountering multiple times and that there's needs that they have that are not being met, please make sure that information gets to us somehow. So whether it's in your PCR, it's an email sent to me, whatever. Heather wants to know about those individuals so she can help us and we can help the person. Okay. I already touched on how Miss Irene is helping to track some of this through the CAD. We haven't probably used her to her full capacity. She's an extremely talented data analyst. It's a little harder to track the ones that are not associated with EMS reports, like I said, but as this grows, we may pull her in as well. So long-term goal.
Captain Hoffman,
yes,
there's
sir.
a question, will this information be available on a cell phone app or the unit tablets?
So I did have someone ask me, we operate with a lot of flow charts these days. Can I look into developing an app? And I said, I think so. So I think we'll kind of go up the chain of command and see if that would be something we can put together, not only for this flow chart, but we know we have many tactical cards. We all operate off of our cell phones anymore. So for the time being, there's not an app. However, I do have an iPhone or smartphone version of the flow chart that I'm happy to send to whoever wants it. Because sometimes if you can't find the flow chart in your Metis, you can simply pull out your phone and you'll have it there. So I'll have my email at the end. It's mhoffman@baltimorecountymd.gov. Anyone that wants it for their cell phone, just send me an email and I'll be happy to send it to you. I'll have to get back to the group on the app and kind of see if that would be something that would be possible.
If I may, Captain, too, the reason we started meeting and having these sessions to share, one was information sharing and resource sharing, but it started because the thing that was supposed to work didn't work the way it was supposed to, which was calling and getting that phone number. So we've done a lot of work to improve coordinated entry, making sure phones are answered. They on average receive that phone number between 8:30 and 4:30, receive on average anywhere between 1,300 to 1,700 calls a month. It's 5 people that answer the calls. There is a good chance that you will not get the phone picked up when you call. But this feedback loop, we're asking you for data, but we're also asking you for feedback. I take issues in the system not working very seriously. We need that transparency. So make sure that it's elevated to your leadership and up to Captain Hoffman, so we that can then address it through the system. We'll get folks. We were having issues with hospitals discharging people from hospital service who were homeless and didn't know where to discharge them. They used to put people in cabs and hospital gowns and send them to the shelters. We don't want that anymore. One, it's not a good look. It's not the right thing. So if the hospitals weren't getting what they needed when they called that number, we had to call with the hospitals and coordinated entry to try to improve that system. As we build systems and make them better, we do need your feedback. So when things aren't working the way we've outlined it, we want the feedback, right, Captain?
Absolutely.
Yeah.
And we talked about this a little earlier, but if we can reduce 911 use that's not really appropriate for our service, and we can reduce hospital overburdening, we all know how busy the hospitals are these days. You know, we've come up with a whole program with the MDO to reduce our time in the ER so we can get back to the community and serve the community. So same goes here. If we can treat the actual problem and not provide that Band-Aid, which the hospital is not always appropriate for some of these people, then that's kind of the goal, and it's going to just help the whole system. So the resource card, the flow chart. So like I said, it's on all EMS officer vehicles, medic units, possibly more. Just kind of, I need some feedback to see who's kind of willing to play along with this and work with us. So if you feel like your station could benefit by putting them on more than just your transport unit, just send me an email. I'm happy to send them to you. If you think that your station would benefit from me coming out and providing this training in person, especially our volunteer stations, just send me an email and we can make that happen. Okay.
Is there anything you can post in the chat here? Because we can download from the chat.
So I'm going to show you the resource card in just a minute. And then, yeah, if you can pull it into the chat, that'd be great. Yep. So I pulled some of this information. So, you know, we're always going to have people that are going to gripe and complain, and this isn't what we're here to do. But let me just remind everybody that we all got into this job to help people. We're public servants. So if that means we go out as an EMS unit and it's not really an EMS need, it doesn't matter. We're here to serve the public. And so my feeling is that, like in my case specifically, if I just would have said, you know what, you don't have a need for EMS, I can't help you. First off, there's no way myself that I was going to let that family stay out on the street, but we own ethical and probably legal responsibility. So if we can't connect them or it doesn't work out, we at least tried, you know. If something terrible happens to one of these folks and we didn't try to do something, I couldn't sleep at night with something like that. So at least making the effort, trying to get the connection started, getting them into that homeless management system where they can receive resources and case management and things like that. That's kind of where we need to start. This is a couple of things I pulled out of the career size rules and regulations. So we shall meet the public with courtesy and consideration, and it shall be the duty of every member of the department to promote good public relations by giving assistance when it is required in the course of carrying out their duties and responsibilities. We know the fire department is often the solution for much more than just fire and EMS. And as I said earlier, we are public servants, so we should try to do a good job with public relations and just getting people the help that they need, whether it's EMS or not. This is just kind of I'm kind of beating a dead horse here with documentation, but something in your NFIRS, an email to me, something in your EMS report. I think probably countywide, we don't do the best job at documenting narratives, especially in our NFIRS report. So a C number of the person putting in the run and a timestamp doesn't tell me anything about what you did. Give me one sentence what you did, so that, and especially for this purpose specifically, so we can pull some data and know what occurred on your call. Here's my email once again. It's mhoffman@baltimorecountymd.gov. Please send me feedback, send me suggestions for improvement, problems with the process that you've encountered, anything related to this. We want to know about it so that when we meet, we can provide that feedback. Let me pull up the flow chart so you all can see it. And then Doctor, you can, as you stated, put it right in the chat. Here.
While you're doing that, there was something in the chat about folks choosing to remain homeless, and we touched on this briefly, but people who are refusing to come in and be in shelter. If folks say that they've tried shelter and that it was terrible, they were, had a bad experience, sometimes it's good to try to unpack that a little bit, ask them where that experience happened, what shelter. There are security protocols that are in place in shelter for folks who do accept shelter. That there's also grievance procedures if people are experiencing issues in shelter. There's a lot of oversight, a lot more oversight now in shelter than there used to be, perhaps. Whether or not you have all the time to go into some of that to be determined. But it is good to try to give them more information and help them understand. You don't have to sign for a bed every night. Nobody's going to push you out every night. You can get there, you can catch your breath. And if it's not working for you, there's services, there's grievance procedures, there's ways that you can get what you need out of the shelter experience in a different way than ever before.
Dr. Barrow, can you see the flow chart here?
Yes, I can see it.
Okay. And
Yes.
so it's a two-sided flow chart. So this is the front and this is the back. Like I said, every transport unit will have a laminated copy in the car and every transport unit. So let's just kind of work through how this looks. Okay. So at the top here, you see that, okay, we've encountered a homeless subject. Does that person have a medical complaint, emergency room need, are they impaired without decision-making capacity? If the answer is yes, then we know that we're going to transport them. Now, maybe that transport is still accompanied by a connection to a resource, okay? But our first priority is getting them the medical care they need. If they're refusing transport and they have any of those things, we know that we should get an EMS supervisor involved in the refusal process if we really believe they need to be on to the hospital. All right. So if they don't have any of those things, and we know that call types are not always accurate, and when we interview somebody, we can find out, like, are you really having an EMS need, or is this you need shelter or a meal? How can we help you? If the answer is no, they don't need the emergency room, then this is when you want to consider, well, why are they homeless? So have a conversation with them. You may want to consider calling for a district officer or the police or mobile crisis or all of them. The way I envision this is those high risk individuals where we really feel like, you know what, we got to do something to connect them right now, because if we leave them, whether it's the weather or where they're sheltering is unsafe or whatever, they're just a high risk scenario, definitely get a supervisor involved in this, because we need to work on this together. Here is that coordinated screening process. So, okay, there's no particular reason why they're homeless, but they want an emergency shelter. So there's that coordinated entry screening process. With the hours, Monday through Friday, there's the phone number, option 1. And then if it's after those hours, that 583 number is going to be after hours. You may have to wait a little while to receive a call back. And like I said, that number is kind of an umbrella number for a lot of different issues, okay? Always have the person call with their own cell phone if they have that. And I help them understand this may not happen immediately, so just try to be patient. This is how we get them started. Going down that same pathway, if we know the freezing weather shelter is activated, inquire with where those locations are. Those are the hours. Are we going to transport them in a medic unit? Maybe. Okay, so that is a decision that you should work out with your district officer. It should not be a decision that's taken lightly. I know that I might get some grumbling or kickback, as that's not what we're here for. But you know what? If they're a high risk person and we don't want to leave them where they are, depending on what the situation is, it may make sense to put them in a medic unit. It's not perfect. I don't want the fire department to become the solution for everyone that's homeless, but there are cases where it makes sense for us to handle the transport. I talked to Heather a lot about the transport piece, and we know that that is a problem, and that is something that is, of course, being looked into. There is not any service that handles those kind of things. Obviously, if they have someone that can help transport them, we would ask them they call on that person. or whatever. But there are going to be those times where it just makes sense, considering all the factors of the circumstance, it makes sense that we transport them. And you know what? That's why a supervisor needs to be involved, because we need to think outside the box here. There's more than one way to transport that person. It may not be in a medic unit. It may be some other way. The police may be able to handle it. Just I can't be there to hold your hand on all these situations, but that's why you need to put some leadership mind to use to make the best decision given the circumstance.
And oftentimes, you guys probably know this too, people will call and they'll have means. They may have a 7-day, card to get on public transportation, and you just need to help them figure out what bus line's nearby. So I have it downloaded on my phone, the MTA app, just so you can figure out where you are and what buses. It's not great. Sometimes the bus transportation is not convenient, obviously, but if the person has the means, at least giving them the information to get on the bus is an option.
So if we determine that their homelessness is due to domestic violence or tracking, here's that. Make sure you request the police department, possibly mobile crisis. Consider the hospitals for a phase evaluation if that's needed. And then there is that domestic violence hotline, 24/7. And then turnaround is that organization that we talked to that is specific to helping people with this situation. So that's going to probably, you're probably going to be more easily able to accommodate a domestic violence issue when it comes to being homeless. For those individuals that are refusing shelter, they don't want a county shelter, that's where you try to have them connected to Prologue. And that's Prologue's number. Heather, do you know what the hours are? You said that goes beyond 4:30. About what time?
Yeah, so the outreach team gets started a little later during the day. So they start answering the calls around 8:30 still. And then the outreach teams can go till about 6. If they are working with someone who is accepting shelter and they need to use that streamlined process, they will stay later to make sure that person gets there.
Okay. If they're a veteran, here's that phone number for the Shepherd Pratt intake line. Okay. And then lastly, if you feel like you have a APS or CPS referral, got to get the police there on that, okay? So we are mandatory reporters on these things as EMS providers. One way or another, it's probably going to be best if both departments report it and we make sure it's definitely been handled. But if you have a case that you know needs to be referred to APS or CPS, you got to call. And so this number right here, the 583 number, is how you're going to accomplish that. The police department should also make notifications. The interesting thing about APS is that they have like a 72-hour timeline legally to get that assessment done. So you would think it needs to be immediate. Sometimes it is not. It kind of depends on the circumstance, but that is something that needs to be reported 24 hours a day, 7 days a week if you think that is needed. We talked about mobile crisis. They may be an avenue. So in the eye care case that I told you about earlier, mobile crisis not only did an EP on this gentleman, but they also handled an APS referral because they felt like it was deemed necessary. Okay, so just remember we are mandatory reporters. The police department also. Okay, you see that all of these pathways lead to the bottom here. It says work with an EMS officer, police department, mobile crisis to determine how the subject can be delivered to a resource. There is not going to be a simple way for any, it's really going to be circumstance dependent, okay? So work with your supervisors to determine what is going to be the best way that we deal with this. It could be a situation where maybe they're not super high risk, but we know that we really need to try to do a good job to connect them. And let's just say we are slammed with calls and our resources are slim. At least we know where this individual is. Maybe the EMS officer checks in on that person a couple hours later when the call line slows down. Okay. Like I said, the fire department, our job is to protect the community, which involves these people as well. But if we can't get to some of those emergencies, that's when you need to get a supervisor involved to kind of help make those decisions. I don't want a medic sitting out there for 2 hours, but depending on what's going on, you may just have to. So let me show you the back of this flow chart. So this has got a whole lot of different information to kind of it's all encompassing from the front. So we talked about the different emergency shelters and where they're located. So on the left side, you'll see, once again, this coordinated entry process and all of the actual addresses of the shelters. This does not mean that you can just show up with somebody at one of these shelters. You have to go through that coordinated entry process. But let's just say, depending on the situation, you get them a bed and they say, yes, we have a bed available at Night of Peace, and the situation warrants that they're high risk, and you know what, the fire department's going to handle getting them there. Well, there's the address so we know how to get there. Okay. A little bit more about the freezing weather. Here's some of those other phone numbers for different outreach programs that are available. That number for domestic violence there as well. There's websites you can go to visit this. Let's just say the county shelters, we basically tapped out all of our potential resources. The city shelter hotline is also here. You could try that. You could simply just do 211, and that'll get you to a resource for the city. And maybe the person like frequents the city, and maybe they're preferring to go to one of the, whatever. I don't know, but that's the number there in case the county shelters, if we're not able to connect them. Here's some of that domestic violence information and all of the different groups and hospitals that offer support for domestic violence, and each one of those forms of support is listed here, what they're all good at doing for those individuals. Lots of phone numbers. At the bottom here, you'll see the language line. So I got a really good suggestion earlier in this process to include that. So, you know, we may encounter, this isn't specific to homelessness, but we know that we encounter a lot of non-English speaking residents and visitors to Baltimore County. So there's that information right there for you. You just got to call the number. They'll ask you for a client ID. This is the county fire department's client ID. And maybe this helps you communicate with somebody, whether it's homelessness or not. Now you'll know kind of where to go to find it. And then finally, in the right column, the addiction and substance abuse resources. So here's the peer recovery information with the Narcan kits and their phone number. We talked about that the Eastern Family Resource has that walk-in clinic for those individuals. Some numbers for just NA, and then if a family wants to make a referral on a family member to NA, that's a number for the family to use. Same goes for alcohol addiction. It's worth noting that the peer recovery team, unless it's associated with like an opioid abuse, they don't handle just alcohol abuse. But they are a good resource. If you're not really sure where to connect somebody to, they can certainly help you with that. Here are the numbers specific to alcohol abuse. I threw in a Gamblers Anonymous number. Who knows? Maybe the person became homeless because they had a gambling problem. Here's a number for the Gamblers Anonymous. And suicide prevention, obviously transport those as appropriate. Request the police department. That may be an EP situation. There's a national hotline for suicide prevention, the 988 or this longer 800 number. And a couple other hotlines for suicide prevention. So like I said, this will be in all your transport units. Please use it. Email me with problems with it, process problems. If the flow chart is not working, I want to know about that. We've only had an opportunity to use it a couple of times so far, but I'm very interested to know what roadblocks you run into, if it's working. If it's working for you, I want to know that too. So please send all of those suggestions and feedback to my email, and we will be able to include that in all of our meetings that are upcoming. I see there's a lot in the chat, so I think we just kind of open it up to Q&A and personal experience and what have you.
So I was also able to take a snapshot and put it into the chat. So if anyone's in the chat, you can either take a picture of the screen itself. I'm sure Captain Hoffman will toggle back and forth. I also took a snapshot and put it in the chat if you want to download that as well. Yeah, there are a couple of comments. Heather says Google Translate on your phone can help in a pinch for translation for sure.
Yeah, we definitely all use that.
And then there was something, do you see the one? Sorry, my dog was crying. I stepped away. Did you respond to The one says in regard to APS, they also do not have to do an investigation just because it is reported. Please make sure to include as much detail as possible on what makes the individual vulnerable.
And on the case that I described, there was no question that this gentleman, it was at the very minimum going to be an eye care referral for us. I didn't think he met criteria for, and that criteria is, I feel like it's discretionary. I didn't feel like he would meet the threshold for that, but the mobile crisis team absolutely thought that. So don't be afraid to refer someone if you're like, I'm not sure if they meet that. Go ahead and do it. If you have that feeling like maybe I should, just go ahead and do it.
Good advice. Any other comments or questions for Heather or Captain Kaufman? Well, what a ton of great information. Thank you so much. Thank you for putting this together. This, this flow chart seems quite helpful.
I appreciate it. A lot of work went into it. I just hope it works out for us. Like I said, please provide us with as much feedback as you can, because we're very interested to know how this goes. I am not naive. I understand a lot of the people that you may ask about whether they want a resource or not might use some profanity and tell you to get away from. I get that. It's worth a try. We're not gonna, even if we make a small dent, very small dent, that's something. And the ones that especially are high risk, we want to make sure that we get them connected to a resource. Oh, so I guess I should give you a heads up on my situation. So, like I said, we probably spend an hour or two all Googling phone numbers and making phone calls. We even tried the after hours number. I received a phone call back from the on-call social worker for the county. While she was very nice and helpful, she kind of ran into the same roadblocks as we did. There wasn't any beds available that particular night. The screening process was closed for the day. So we did determine that that young mother was the victim of a domestic violence situation. The police department were able to get in touch with Turnaround, and Turnaround over the phone was able to talk to her and the police and got her a hotel stay for that entire weekend. So we could at least get her to Monday morning, when then the coordinated entry screening process to pick up on the rest. And so, yes, we transported her in the medic unit because there was no way, even though we were busy that night, that any of us were leaving a young mother with 3 kids on the street. We made sure that they were going to be safe. That's just the way it worked out. The police department is not typically able to accommodate transporting children. They were super helpful and wanted to help as much as they could. They just really can't transport kids. So we made it work. Get supervisors involved for the logistics. We'll find a way in those high-risk situations. So that's what happened with her.
And real quick, we are going to, I mentioned a homeless resource card. It's called a street card, and it is a pocket-sized card with many of the phone numbers that you're seeing on this flow chart, but the target audience is the person themselves experiencing homelessness. So we are having those printed. We've updated them with all the updated numbers, phone numbers, and resources. So at least that's a good leave behind. We're going to print enough to try to leave as many as we can in each of your vehicles so that you can leave those behind.
Yep, and as soon as we get them, we will start distributing them so that we can leave them with something. So thank you for that, Heather.
Thank you for your leadership, Captain.
Captain Hoffman, there's also a comment from Coast who says there's also legal services available to the homeless population, Pro Bono Resource Center of Maryland and Maryland Volunteer Lawyer Services.
Great.
Thanks, Coast. Okay, guys, well, if there are any other questions, again, thank you guys so much for being with us tonight. Thanks for sharing all this information, all the work behind the scenes to pull this together. Thank you.
Yeah, thank you.
Thank you for the opportunity. Thanks, everyone.
Thank you. Thanks for all you do.